So what is depth of unconsciousness monitoring? So in surgeries or ICU settings, depth of unconsciousness is measured to ensure the patient is not awake or aware during procedures. This is typically done using BIS monitors, bispectral index, EEG-based machines that measure brainwave activity to give a numerical value from 0 to 100, indicating how awake a patient is, or clinical signs, heart rate, blood pressure, pupil size, movement, all used in conjunction with the BIS or other monitors to detect awareness. In surgery, even a slight chance of awareness during paralysis is considered unacceptable because it's terrifying and causes long-term physiological trauma. All right, so of course, these who does this? An anesthesiologist, right? That's the whole point, right? That's what I'm trying to say. The anesthesiologist is required for a MAID, right? A medical assistance in dying, which is the whole point here. So what happens in MAID, right? In most MAID procedures, no BIS monitor is used, no anesthesiologist is present. The medications used vary, and there's no guarantee of full unconsciousness. That's scary. I mean, if you can imagine for a minute, right? You're paralyzed. There's a paralytic, and you're not 100% unconscious, and then they administer the lethal agent, and it's so much pain. It's incredibly painful, and then you can't do anything about it. This is a real problem. I mean, this is a real serious problem. Oh, who cares? The guy's gonna die anyway. Well, if that's the kind of you know medical establishment you want to you want to base your trust on. I certainly don't. I mean, that's the whole point, right? We should trust our medical establishment for the best, the number one, and at the people at their most vulnerable stage, the infants, the sick, the ailing and the sick, and all that stuff. Yeah, I mean, these people are need the best care, and what are we doing? We're not giving them the best care. I mean, that is the point of this entire channel is dedicated to this very, very important medical error. All right, this is an error, and it's clear to see, but it's less clear to see how they will respond. Right, so I've filed grievances before, and basically they just stonewall you and say, you're just this stupid guy, and we are your overlord. No, 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 no. They are public servants, right? And they should feel very, very privileged to be in that position, and they should certainly listen to the people that will not only provide their salaries, but will provide the actual physical patients for them to be employed in the first place. These people need to get a wake up call. These people are public servants, right? And they are not our overlords and masters like they pretend to be. So a paralytic drug is often administered to stop breathing and cause death, but once that's given, the person cannot signal if they are awake, even though they are, right? So a paralytic may not cause unconsciousness, and there's no monitor to be used to determine whether or not that is the case. So if the sediment dose was too low or too slow and the paralytic was injected anyway, the patient could die in full awareness, unable to move, breathe, or cry for help, which is the whole point of MAID, right? That's the whole point. Literally, and I think it's a case of they advertise it as a peaceful, yeah, we're you're just gonna drift off to sleep and all this stuff. Drift off to sleep. I mean, that's a great, it's that is their main selling point, right? They're just drifting off to sleep, but it really is not how it happens, right? But for an anesthesiologist to be present and to really make sure there's unconsciousness there, there would need to be these types of monitors and things like that. And the anesthesiologist is certainly required for MAID. I mean, come on. I don't know who's going to argue against me on that one, but the problem is it's not happening, and this is a serious ethical concern. This argument has merit, and I believe if you spend about 10 to 15 minutes researching this, you'll see that this argument does have a merit, and the anesthesiologist certainly is a basic requirement in such a serious procedure such as medical assistance in dying.